Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
Welcome to the Ask Dr. Cummins Show, 587-8176. Good afternoon, Dr. Cummins.
Good afternoon, Lee Allen. How we doing?
Fine. Did you have a good week?
Good week. Enjoying the beautiful weather. And I think it may rain today, but I think it's going to clear back off.
How is your Saturday, open on Saturday, working out?
Boy, we've been busy, and apparently we're feeling a gap that was in the community that was missing, and we're just really enjoying it, and I think it only is going to get more busy.
Well, you know, a lot of people work Monday through Friday, and a lot of times maybe that's the only way they can go to doctors at night to the emergency room. So maybe you're going to alleviate some of the load on the emergency room.
And that was our thinking. You know, you have a certain group of people who are in America, but in our area in particular, are towing the line, doing the work out there every day, and they don't have time or can't get off work. So we're there for them to serve them.
Well, did you have any special announcements you might want to mention before we get into our questions?
I wanted to mention that we've already passed the date, but from the 6th to the 12th of March was National Patient Safety Awareness Week, which basically means, you know, making sure in good prescribing habits with medicine. It's always a good time to review all your medicines, make sure the best drug is no drug and those type things. Might want to review with your doctor your medicines that you're taking, make sure everything you're taking is safe and that your labs are being monitored with the medicines that you're taking if they're high-risk medications. The only other thing I was going to mention is that due to our practice growing, we are looking for further provider-type associates, whether it's a part-time or a full-time position. That could range from another doctor to a physician assistant, to an advanced practice nurse, or commonly known as nurse practitioner. Those type people, if you're looking for some part-time work or full-time potential, feel free to drop by a resume at the clinic.
That might be a good opportunity for somebody out there if you feel like you might want to fit into that. I guess this Saturday practice has helped open up that situation.
It has, and also even if you have some experience in the laboratory and we're looking for maybe some part-time work as well to supplement your income, you could feel free to drop off a resume there
but
too.
Just do your resume and drop it by the doc's office, and they'll take a look at it, and be sure your phone numbers where they can contact you are on there so they can get in touch with you. And
we're always looking for good people.
Right.
That want to take care of people.
Never enough good people.
That's right.
That's right. Well, Doc, let's get straight into it. I put a star by one. She's going to be watching. This lady has a toe pain. All right. She says it's caused by a fluid pill. Now, if she quits taking the fluid pill, her feet swell up, but the toe don't hurt. Now, what can you say to that? She has a toe pain, right, and she thinks it's caused by the fluid pill. But when she quits taking the fluid pill, her feet swell up, and she doesn't have the toe pain anymore. I never heard of that.
The first thing I thought of when my mind was going through was, is this an electrolyte imbalance or disturbance? And what I mean is her sodium, her potassium, her chloride, things like magnesium, trace elements that you have in your body, or whenever she's taking the diuretic, it's keeping that in tune. That's right. But when she stops taking it, it starts getting that swelling, and that's called a third spacing of fluid. It's not a regular space, but a potential space, and it starts filling up. Her electrolytes may be moving in the wrong direction, and then starts having that pain because that balance is out of whack. That's the first thing and probably the most common thing, okay? The other thing, though, is she could be having some vascular, either venous or arterial, that's the two parts of your circulatory system, the blood supply. Is something going on where blood is not getting where it needs to go, or is too much all of a sudden going in there? Because you can either, with too little blood supply, you can have pain, but also if a place that has not had blood supply all of a sudden gets revascularized, or the blood starts back, that can also cause pain. So there's a simple test, I think we might have discussed it last week, that one for peripheral arterial disease, ABIs, ankle brachial indices. We can do those even in my clinic and to see if they've got the right blood flow. Those are some common things. It could be a number of other things, right? Just a muscle spasm and whatnot. It may not even be directly associated with that medicine. But if that thing persists, she needs to get checked out.
Okay. Hope that answered your question. Got several questions here. Let me read them and then I'll make a comment and then we'll get an answer. Can a tanning bed help psoriasis? Does staying in the sun clear up acne? Can a tanning bed help that? Or arthritis, acne or arthritis? And then when is it better and safest to tan? Or what's the difference? Is it safer to use a tanning bed over the sunlight? So these are tanning bed questions that can be generalized because it's becoming that time of the year and people are starting to get the itch.
Right.
And I guess basically what they're wanting to know is the pros and cons to the sun and the pros and cons to the tanning bed and which might be a better way to attack a tan. And then psoriasis and arthritis also with a tanning bed.
And I got to walk a line on this because there are some benefits, obviously, to the sun. And I'll start first with a psoriasis patient. There are some benefits to ultraviolet light in a psoriasis patient that can make the psoriasis improve or get better where they don't have the problem.
From the sun.
Correct. And from tanning beds. The thing about UV light in a tanning bed, if they're maintained and you will know the exact amount of UV pretty much is coming from those regularly. If it's not maintained well, you may not know that. That may be the only benefit from treating a psoriasis patient with UV because you know for 10 minutes how much UV they're getting for that exact amount of time. But with the sun, essentially on a sunny day, you can know the same thing, but you really have to be careful. I'm not going to say tanning beds are wonderful because we know too much tanning in a tanning bed will cause skin cancer.
And the sunlight too.
Right. But the intensity of folks, yep, the intensity of folks in those tanning beds though are commonly a lot of people misuse them.
Overdo it,
right.
Overcook, yeah.
And there have been bad cases of people even dying from being actually cooking themselves.
Mm-hmm.
But
well, I think the dial on mine goes up to 25 minutes.
it's a
From
long
0
time.
to 25 minutes.
Yeah, it can be a long time. And but the American Academy of Dermatology, no tanning beds unless you're treating psoriasis. That's it. No tanning beds for anybody.
Well, that's your experts saying that.
Yep. So I'm giving that's the guidelines.
Well,
okay.
that's the experts.
But
That's
that
what they
being
wanted to know.
said, I've seen the winter months where people have low vitamin D, and we have prescribed them some sunlight therapy, and they do see some improvement. But this stuff has to be very well controlled and very limited use. The worst sun damage from the sun occurs from about this time of year, about mid-March, to about mid-September, the first part of October, and typically from about 10 to 10:30 in the morning to about 2:30, 3 o'clock in the afternoon. That's when the sun's rays are most direct and most intense. And that's typically when we're most likely outside. So few people now work outside, you can get burned real easy because you're not used to being outside and you haven't got that farmer's tan or anything to protect you. Because tan is essentially a protective mechanism
Right.
to protect your body. So when you go on spring break or you go on your summer trip, you want to make sure that you do some sun protection if you're going to be out at the beach for a long period of time. And typically an SPF or sunscreen or sun protection factor, about a 20 to a 30 applied every 30 minutes while you're outside, no matter what brand or type it says, per the American Academy of Dermatology, is going to be your safest and best bet. But I'm all for people being outside. I don't want anybody to think I'm telling you to stay inside and avoid the sun. But you just need to be careful. And if you particularly have light eyes and light complexion, your chances of getting a skin cancer are increased. So that's when those type folks really need to be regularly screened for things such as melanoma and other type of skin cancers. That being said, our citizens and stuff in this area who are more darker complected, Hispanics, Black Americans, they can get skin cancer too, and they'll get them in places where it's not commonly expected, usually where they're more lighter complected, the palms of their hands and the soles of their feet. That's been studied, so they also need to be regularly checked.
Yeah, okay,
And
I've heard that.
everybody's got to be watched on it. But do get out and enjoy the sun. I love the sunny South, and we need to be out in it, okay? But
Yeah, it's got to be good for you.
just goes back to what we talk about a lot of times, spectrum of disease, moderation in things that we do, and you'll be okay. But I guess just a quick recap is the official stance is no tanning beds unless you have psoriasis with really close treatment being monitored by your doctor. Probably some wiggle room for people during the winter months to enhance that vitamin D, and because you can get that seasonal depression. It's called seasonal affective disorder, SAD, and maybe some other few changes there. But everything's moderation. I can't stress that, overstress that.
All right, we hope that helps on the general questions about the tanning bed. And before we go to our break, I'd like to mention one question that I have. What is the greatest serious problem the Japanese people will face? Will it be hunger or will it be dehydration? Now that's a very...
Yeah, certainly our hearts and prayers go out to the Japanese people and nation for, they haven't, this is a terrible thing that's going on over there.
It's just hard.
And we have a lot of waste stored here they don't know what to do with, radioactive waste. But
Yeah.
well,
they're taking it out west, aren't they?
Yeah.
I think
And,
that's been the big thing.
the number one problem that will affect the most people probably is going to be post-traumatic stress disorder.
Okay.
Depression, and dealing with assimilating that into their mind and spirit. But physically, you got to have water. Dehydrate, you'll die more likely from not having enough water, clean water, than you would not having food.
Well, that was I got in a talk with somebody, and that was my argument, that water in a situation like that, water is more important at that particular point in time than food.
Absolutely.
And he said that food was more important than water.
Got to have water. Got to have water because you have to have water to excrete the waste products that your body builds up. You don't have to have food to do that, but you got to have water to make that system churn. You can go longer without food than you can without water.
Okay.
Without a doubt.
All right, that's a question I had. We have a guest today, and we're going to take our break. Tony, let's take our break, and we'll be right back with a guest.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine. 100% veteran owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now, welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
We're back, and we have a guest with us today. First of all, 587-8176. You see the number. Please call that number with your questions, and we will try to get you answers. Dr. Cummins has what would you say, a respiratory pulmonary?
Respiratory therapist.
And that's your title, a respiratory therapist.
Yes, sir.
This is Nathan McVeigh. How long have you been with Dr. Cummins?
I've been with Dr. Cummins for almost 3 months now.
Okay. Are you going to be is it going to be permanent, or are you?
Yes.
Okay,
Yes,
so
you're
you're
permanent.
now. Our previous guests have come and they're doing residency or whatever you want to call it, but now you're lined up to be.
Right. I'm permanently there. I'm doing the pulmonary rehab program for people with
COPD.
lung disorders and COPD and such. So.
Well, do you? I guess what I'd like to ask, and I asked this question of the other guests that have come on. What type of training, what type of schooling, what type have you gone through as far as your background in your education to get to be where you are today?
Well, it's basically the same length of time as it is to be an RN nursing school. It's a total of 3 years. You have to go through a lot of your basic hospital type training, whether it be from all the way to emergency medicine, intubations, all the way to PFTs, pulmonary function testing, and a lot of your pulmonary rehab
Now,
stuff.
is this when you say 3 years, is this something that I could go and in 3 years, if I started from scratch, in 3 years I have it, or do you have to have a 4-year degree and then the 3 years?
No, just 3 years.
Okay, so you don't have to have a BA or whatever you call all that stuff. Okay, that's good news to younger people that are sitting out there wanting to get into your field. That's great news.
Right.
Just a 3-year program. That's good.
And it's a good field to be into right now because our elderly population right now is, as we know, growing, and it's larger than it's ever been. And so we're seeing more cases of people with COPD because during the 50s and 60s, smoking was
very.
It was the trend, and a lot of people didn't know that it hurt them like it does. And so now we're seeing a lot of people with COPD and lung problems.
Well, I've got to give it to Nathan, and this is a personal experience. I've got COPD, and I called up and got an appointment with Dr. Cummins and came into the office. Thomas is, he took me back to the room. Thomas is another, we had him on, he was going to be, he'll be on a future program. But he sat me down and took my blood pressure and all that kind of stuff, and he was real worried about me because of the way I looked. So he puts that little old sticky thing on my, or not a sticky thing, but a little old thing, like a clothespin on my finger. And it showed 75, and he got bent out of shape.
Yeah.
Well, not bent out, but he got greatly concerned about legality. And so he put me on that breathing nebulizer machine, whatever you call that thing. I call it the nebulizer.
That's great.
And that snapped me, I guess it was albuterol sulfate.
Yeah.
That snapped me out of whatever I was in, but you came in, and just by looking at the situation and reading the data and looking at me and everything, you said, here's what you need to do. And I said, okay, please tell me, because it's no fun not being able to breathe. And I had been in this shape, but mainly not only not being able to breathe, my oxygen level was
Right.
terrible.
It
was
was.
at 72. You remember that?
Exactly.
It was at 72, and Nathan told me, he says, here's what you need to do. And I hope a lot of you COPD patients are listening to this, because Nathan has been a godsend to me over the last 6 weeks, because it's made me feel a lot better. I still have trouble breathing, I'm not saying that. But he told me to take deep breaths through my nose, and then inhale through my nose heavy, and exhale through my mouth. Can you tell me why?
Okay.
Like you told me when that happened.
The reason why that is because when you suffer from COPD, you have a problem with a buildup of carbon dioxide in the lungs.
You're not getting it out. That's what
You're
you
not
told me.
getting it all out, okay? And
That's
have
exactly what you
you
said.
have a
You're not
buildup,
getting it out.
and that affects many other parts of your body. And so when you inhale through your nose, then you exhale through your mouth a longer period than you did when you inhaled, you get rid of more carbon dioxide. Okay, and that helps you feel better. And it also helps with stress and relaxation. And that's a big part of when you have a episode of shortness of breath, is being able to relax and sit down and calm down and breathe. And that helps a lot.
So you would say that the COPD, not necessarily all inclusive, but basically you're not getting rid of the carbon monoxide
Right.
in your body.
Right, exactly.
You're breathing in, your lungs make the oxygen or whatever it does they do, and
Right.
then it has the offspin's carbon monoxide.
Right.
And another lung function is to take it in,
Right.
oxygen,
Right.
put it out.
Exactly.
And when you got COPD, so could this be like an effect with people it may help people with panic attacks to breathe deeply through your nose, inhale deeply
Exactly.
through your nose.
I'm sure it could.
As well, it's like a paper bag.
Right, exactly. And your lungs function in that way when you have like emphysema. I compare it to your normal lungs are like a balloon. Okay, when you inflate them, they naturally, because of the elasticity, they deflate. Okay, they push the air out. When you have emphysema, I compare it more to like a paper bag. Okay, they'll inflate, but they're not going to deflate.
Right.
You know, so that's when you have your carbon dioxide buildup in your blood.
Well, I've been told and have heard, and I don't know whether it's an old wives' tale or not, but when you think you're having one of these altercations in your mind where the world's coming to an end in a fashion like that you get a paper sack, put it over your nose and your mouth, and just constantly breathe in that paper sack, and supposedly. And that would have to have, I would think, maybe the same effect of getting your oxygen back up. Or maybe that's not even connected. I don't know.
Yeah, I don't know if that's
You
actually
sure got
connected or not.
in my situation, my hat's off to you personally, because, and I'll attest to that. We're going to do a show on Daryl's little corner that'll be coming up. I don't know when exactly she'll show it. We'll let you know on the next doctor show. But we're going to come in this coming Monday, Nathan.
Okay.
And we're gonna video shoot. I guess we'll use me as the guinea pig,
Okay.
and maybe kind of take it from start to finish if we can do that and get it on
Yeah.
film and let everybody know exactly what it is you do.
Right, pulmonary rehab. Yeah.
Right. In other words, I went through your initial setup, and we went through several different things, and
Right.
Daryl thought that might be interesting to all. We've
That
got a
would be
lot of
great.
people here with COPD.
Right. And pulmonary rehab is sort of a new concept because we're finding out that, normally with your people with COPD or lung problems, they would have, 6 to 8 hospital visits a year. And that would cost the insurance companies tons of money.
Thinking they were dying.
Right. And with pulmonary rehab, now we found that we're cutting down to, maybe one hospital visit a year, at the most. And so that's saving the insurance companies money, plus it's saving you
Well, that's
a
6
lot
times
of
you don't think
stress.
you're gone.
Right, exactly, exactly.
Just to call it like it is.
So what we're doing is I've found that it's really helping our patients, and the ones that I'm working with now, if you could talk to them, they could tell you just how much better they feel within, I'd say 3 to 4 weeks. It makes that much of a difference.
Where are you from, Nathan?
I'm from Booneville.
Boonville born and raised.
Yes, sir. Born in Boonville, actually lived in Corinth for
When
a
did you
long
graduate out of high school?
time. I graduated from Alcorn Central in 1995.
Alcorn Central.
Yes, sir.
1995.
Yes, sir.
Okay. Have you always been in the medical field, or did you do things other than medicine?
No, I went back to school when I was about 25 years old.
Okay.
Hmm.
What did you do to 25?
I actually
Whatever
tried to raise my children and just worked.
How many
and,
youngins you got?
I've got 3.
3 youngins.
Yes,
What are their
sir.
ages?
I've got a 13-year-old daughter, a 8-year-old son, and a 6-year-old daughter.
Okay. All right. Well, they go to Boonville. Are you?
No.
Where do you live now? I guess
They go to Kossuth. Their mother lives
Kossuth?
in Kossuth. Yes,
Okay.
sir.
All right. Well, you've got quite a family. You
I
said
sure do.
a daughter and 2 sons.
I got 2 daughters and a
2
son.
daughters and a son.
Yeah.
Okay. Well, doggone, I'm gonna tell you what. We look forward to, especially the part. I didn't look forward to the exercising part.
Yeah. Nobody
That's
does.
too much like
Yeah,
work.
but
You gave us a series of tests there, and each test you gave a full explanation. And I have to commend Nathan. He, a lot of times you start as a patient, but Nathan makes it very enjoyable. Your equipment, you're fully equipped, right?
fully equipped.
You have a fully equipped on-site, what do you call it? Pulmonary rehabilitation.
Pulmonary rehab facility, pulmonary rehab office, I guess you could say.
Okay.
But yeah, we've got everything you need there. We've got all your the tools to do your breathing exercises, nebulizers for your medicine, your breathing treatments, and we've got your exercise equipment and everything. So
You've got 2 different kind of medications. You've got albuterol sulfate,
right,
and that's a 4 time a day treatment. And then I don't know what you call this other one. It comes in a smaller vial. But
okay.
it's tell me a little bit about that other one, because I'm a COPD patient. I haven't used that yet, and I'd like to know what comparison, because I'm on that albuterol sulfate as far
Right.
as me trusting it.
The one that comes in a smaller vial is actually called Brovana, is the brand name.
Brovana. Okay.
And it is a longer acting drug. It's a 12-hour drug, so it's only twice a day. It's a twice a day drug.
Let's say you got it crossed up. Would it absolutely be critical if you crossed them up in the same application? Now I know Thomas told me not to. He says,
Yeah.
now don't do both. Do
Yeah.
if you're gonna do one day, do the what you said, or
Right.
do the albuterol sulfate.
Yeah.
But don't do both.
If we have patients on both albuterol and Brovana, what we usually do is have them do it at different times of the day. You do your Brovana twice a day, and in between, do your albuterol. Maybe a couple, 2 to 3 times a day in between.
Okay, so it wouldn't be life-threatening if you had a little bit of the Brovana in with the albuterol sulfate. Wouldn't be life-threatening.
I wouldn't recommend mixing them both and doing them both at the same time.
Okay.
You
That's
know,
kind of. I guess that was a better way to put it.
Yeah, yeah,
That was kind of what I was asking.
yeah. I wouldn't recommend doing that.
Okay. But anyway, we'll what we plan on doing is coming in at 1 o'clock and shooting the rehab facilities that Dr. Cummins has in his office.
Okay.
Nathan, you'll be our guide.
All right.
We'll have you on television again.
Good deal. Good deal.
And what we'll do is we'll try to go from, so you be kind of thinking about, we're coming in Monday at 1 o'clock, so you
Right.
kind of be thinking about what you want to express. This will be a different scenario than this. This will be an hour program.
Okay.
Now, I don't say we'll be filming an hour on what you need, but I would guess that probably in order to do justice to the department, we need to spend at least 20 to 30 minutes filming
Right. Yeah.
a process that
Yeah.
somebody goes through when they come in and use you
Exactly.
as the,
I'd love to have the opportunity to show the whole procedure from
Well,
start to finish. So.
you're fixing to have that money.
All right.
All
Good
right,
deal.
and then, all right, Nathan, we certainly appreciate you coming on, and we, even though when they do see you, it's on unpleasant circumstances, but I want you to feel good. He takes good care of his people, and he
That's
makes
right.
them feel good and wanted, and that's a lot of what it is. You got a
Yeah.
good bedside manner.
All right. I
Thank you for
appreciate
coming
that.
on. Anything you'd like to say before we get off?
No, thank you. I just appreciate you having me here.
Okay, glad to
Thanks
have
a
you.
lot. And if anybody has any pulmonary needs, feel like they have any problems with their breathing, just come on by and
Your
see us
call.
at Dr. Cummins' office.
We thank you for coming, Nathan. We thank Dr. Cummins for coming. We'll be back, 5878176. We'll be back next week. We'll see you next week. Good night.